Hello and welcome to Lema Dental Clinic. In this video, we'll walk you through how root canal renewal is done step by step. Root canal renewal or retreatment is done when a tooth previously had a root canal becomes infected again or painful. This can happen if the original treatment missed a small canal, wasn't sealed properly, or if new decay has reached the root area. You may need this procedure if you're feeling pain, swelling, or sensitivity in a tooth that's already had root canal. Sometimes, even years later, the area becomes reinfected and needs attention again. Here is how we do it at Lema Dental Clinic. First, we take a detailed X-ray or 3D scan to evaluate the tooth and the surrounding bone. Then, we numb the area completely, so you stay comfortable during the entire procedure. Next, we open up the tooth, remove the old root canal filling, and clean the root system thoroughly. We disinfect the area and shape the canals again, just like during the first treatment. Sometimes, we place medication inside for a few days to eliminate bacteria. Once everything is clean and dry, we seal the canal using biocompatible materials to prevent future infections. In most cases, we finish by placing a crown to protect and strengthen the tooth. It's a conservative and highly effective way to treat reinfection or failure from an early treatment. If you have pain or discomfort in a treated tooth, don't wait. Reach out to Lema Dental Clinic for expert care.